Hello guys, and welcome back to the channel. Today I'm going to be talking to you about how diabetes can cause kidney disease. I'm motivated to make this video because as a nurse, I've come to realize that a lot of my patients whom I've come across in the course of my practice don't seem to know that diabetes can lead to kidney disease. And we all know how dreadful it is to hear or to get a diagnosis of kidney disease. No one wants to hear that for his or herself or for his or her loved one. So it's really, worrying to know that a lot of people who even have the diabetes do not know that this is what it can lead to if not properly managed. So I've also come to know that in the course of my interaction with people, a lot of people too do not know. It's not just about patients, but generally a lot of people do not know this. So I'm here to let us know exactly how this happens. Now, before I do that, I also want us to know what the kidney does for us. And so knowing this will or will motivate us to see reasons why we should protect our kidneys. Now, kidneys, as we know, they are two bean-shaped organs whose major function is to help in removal of excess waste products from the body. And this excess waste product is removed through the filtration of blood. So the kidney filters the blood, removes excess waste products and also excess water. So that is what we pass out as urine. So this is the function of the kidney. Although the kidney has other functions, but for the purpose of this video, we are focusing on the removal of excess waste and excess water. Now, this is what the kidney does for us. So how does diabetes cause kidney disease? Now, diabetes, as we also know on the other hand, is when we have high level of glucose in the blood. This is when we don't have enough insulin, or the insulin we have is resistant. We are having what we call insulin resistance. Now, that leads us to what we call the type 1 and type 2. So in type 1, you are not producing insulin at all. But in type 2, you are just producing too little, which is not enough for you, or the one you're producing, which may seem to be enough, is not, working effectively, which is what we call insulin resistance. So that is just the difference between type 1 and type 2. I just hope it makes sense. In type 1, no insulin is produced, but in type 2, you're not producing enough, or the one you're producing is insulin resistant. So that is just it. Now, having come to know all of this background knowledge, we know what diabetes is, and now we know what the kidney does. How then does diabetes cause kidney disease? So what actually happens is that in diabetes, it leads to what we call microangiopathy. It's not so much of a big grammar. Let me explain. Micro means small or tiny. Angio means blood vessels, and pathy means diseases or disease condition. So now, discussing it as microangiopathy simply means there is destruction of the tiny blood vessels in the body. So now, when you have these high levels of glucose, which is not properly managed, it now destroys these tiny blood vessels. And the kidney has a lot of these tiny blood vessels. So it now destroys these tiny blood vessels in the kidneys, and this makes it very difficult for the kidneys to carry out their functions. So it makes it very difficult for the kidney to carry out its function, leading to kidney disease or an eventual kidney failure. And this is what nobody wants at all. Nobody wants this. So for you to prevent this, you have to adopt healthy lifestyle. When I say healthy lifestyle, don't just dismiss it. It is not just about taking medications. Yes, you have to take your medication. That is one of the preventive measures, in fact. But when you talk about healthy lifestyle, it's all about taking preventive measures. One, ensure that you participate in a lot of physical activity. Avoid a kind of sedentary lifestyle. Ensure that you are active. Take part in exercise that is good for your health. All of this has to be, you have to put into consideration your health condition at the moment. So that is it. You also make sure that you stick to your appropriate dietary plan. Speak with a dietitian who will give you the right kind of food to be eating to maintain your glucose levels. And do not forget to check your glucose levels regularly, because without checking, you won't know if it is good or bad. And finally, get enough sleep. Thank you for watching. Do not forget to share, like, and subscribe to my channel. Thank you so much. See you in my next video. Bye for now.